Dr. Craig Benton. I'm a doctor of chiropractic at 105 North Key, Lampasas, Texas. Our phone number is 512-556-8223. I'm going to talk to you a little bit today about shoulder anterior impingement syndrome. It is the most common shoulder injury that we suffer, and it's mostly due to an overuse type of injury. So it's not something that we do and it starts hurting, but it's been kind of nagging, gets a little worse with time. And what happens is there's an injury to the rotator cuff muscles. With the rotator cuff muscles are supposed to be the major stabilizers of the shoulder joint. They either get weak, they go into spasm, something happens to them, and they don't support and stabilize the shoulder like it should. So a normal shoulder joint, you've got the top of your shoulder right here, and then you've got your arm bone that comes up here. So this space in between is where all the tendons and ligaments run in the shoulder. Well, what happens in this anterior shoulder impingement is that space in there gets smaller. It can get smaller because there's some instabilities with that shoulder and the muscles pull it up higher. Or you could have a little bit of arthritis in that top of that shoulder, that AC joint, which makes that space smaller. And so it irritates the tendons and ligaments, and that's where you get your pain and discomfort from. So what's a couple things you can do? Well, there's some stretches that I'm going to show you in just a minute. But really there's two keys to this. Number one, stretching it. Trying to stretch this down and trying to separate that space in there so there's more space in there. Then once you do that, then you need to exercise these rotator cuff muscles to re-strengthen them so that it will stabilize the shoulder and it doesn't come back again. So today, like I said, we're going to go over some of the stretches that you can do for this shoulder joint. So I'm going to show you 4 different stretches that you can do for this shoulder anterior impingement syndrome. The first one is what we call a pendulum swing, and you just bend over a chair and you roll your shoulder in a clockwise fashion for 1 minute. Stop, then go counterclockwise for 1 minute too. If that doesn't hurt, you can use one of these ankle weights. Put that on your arm, then do a minute clockwise and a minute counterclockwise. Easy to do, and it pulls on that shoulder trying to stretch that opening. Another one you can do is this glenohumeral extension. So you're going to grab your arm, you're going to pull it that way, hold that for about 10 seconds, then relax. 10 seconds, then relax. Maybe do 3 of those every day. The other one is called YTWL, and this is really good to stabilize the scapula, or the shoulder blade, which is important in these shoulder injuries. So what you're going to do is you're going to start off with your arm in a Y shape. Squeeze your shoulder blades together, then bring your shoulders down to a T, squeeze the shoulder blades together, then bring your elbows down, make a W, squeezing your shoulders together, and then coming right back to an L, squeezing your shoulders together. Holding that 10 seconds, all the way through. Repeat that 3 or 4 times every day. And again, Y, squeezing your shoulder blades together, T, W, L. So this last stretch that I'm going to show you is a pec stretch. What you need to do is find yourself a corner. Put your hands, your elbows about shoulder height apart. And then what you're going to do is you're going to lean into this corner, trying to stretch your chest out here. What you're going to do, hold this for about 10 seconds or so, stretch, then press in with your hands, press hard with your hands, then stretch a little bit more. And you can really feel that right in that chest area. So give those 4 stretches a try. See if that might help alleviate some of the pain and discomfort that you have with your shoulder issue. If you'd like us to look at your shoulder, please don't hesitate. Give us a call, 512-556-8223. Thanks for your time.